The second generation type 1 inhibitor gilteritinib has been evaluated as a single agent in relapsed refractory AML and has been compared with chemotherapy in the ADMIRAL study, a phase 3 study in relapsed refractory patients with FLT3 mutated AML, both ITD and TKD mutations. This study has completed accrual and analysis is pending. In the study, patients would be chosen to receive either an intensive chemotherapy regimen such as mitoxantrone, etoposide, cytarabine, or idarubicin with FLAG chemotherapy, or a less intensive therapy such as a hypomethylating agent or even low-dose cytarabine. The primary endpoint of the study is survival, very much like the QuANTUM-R study. However, the data is being analyzed now for response rates as well to see if there's a difference in complete remission and complete remission with incomplete count recovery between gilteritinib as a single agent or chemotherapy in this group of patients.
In the relapsed refractory setting, there have been early trial results presented at the European Hematology meeting on quizartinib on the QuANTUM-R study. And the QuANTUM-R study is a large randomized trial where quizartinib single agent was compared to doctor's choice, and doctor's choice can be intensive chemotherapy or low intensity chemotherapy or hypomethylating agents. Most patients in the control arm received intensive chemotherapy. And there was a randomization 2-to-1, so 2 times quizartinib compared to 1 part control arm. Inclusion criteria that was that only patients with a FLT3 internal tandem duplication can be included, and patients who were refractory to an intensive induction therapy or patients who relapse within 6 months after intensive induction and consolidation therapy. Once they achieved a complete remission, then 6 months of CR duration and relapse within this time frame.
Crenolanib as monotherapy has a 40 to 50% response rate in patients with relapsed refractory FLT3 mutated acute myeloid leukemia. Now, the further development of this drug is as follows. There are phase 1, phase 2 studies being done where chemotherapy, intensive chemotherapy, is being combined with crenolanib, followed by either allogeneic transplant, or in another study followed by single agent consolidation and maintenance with gilteritinib. So both of these studies are being done in the relapsed refractory setting. In distinction to the phase 3 development of gilteritinib and quizartinib, in these studies, the crenolanib is being added to an intensive chemotherapy regimen that we typically use in this population. The third study is a phase 3 study in the relapsed refractory setting of chemotherapy plus or minus crenolanib, and that is being performed by the German AML study group. There are many other agents that are in development. There are other second generation type 2 inhibitors such as pacritinib and ponatinib that are being evaluated in the relapsed refractory setting, and many other FLT3 inhibitors that are in preclinical and phase 1 development.